We're back at 6:44. Imagine needing a medical treatment to stay alive, but you can't maintain it because of the cost.
Millions don't have to imagine. They live that every single day because they need insulin. 5 on Your Side investigator Jonathan Walsh shows us how some diabetics are going to extremes and the fight for change that's ahead here in Ohio.
I can't live without it. So, you're going to pay what you have to pay.
50-year-old David Moss from Broadview Heights is a diabetic.
If I wasn't insured the way I am now, I would definitely go get my insulin in another country.
Heck, his family has done it.
I have cousins that were going over the border to buy insulin illegally.
All because insulin costs passed along to patients have jumped. GoodRx just did a study recently saying between 2014 and 2019, they went up 47% on insulin, of all things. It's not new, it's not experimental, so a lot of people are asking, why the increase?
Actually getting a handle on what the price of insulin is not straightforward.
Sherry Gleed has studied insulin issues. This report released by the Commonwealth Fund includes the many ways insulin gets to patients.
Most of the increase in the cost is not because the manufacturers are making so much money. It's because all the way down that chain, people are making money and making deals that work to the disadvantage of people with diabetes.
Sometimes, so much so,
insulin is unaffordable to the American people.
Children are dying here in Ohio.
Frequently miss insulin doses as Americans do because of the outrageous cost. That's why my daughter passed away. We couldn't afford it.
We'll go ahead and get started.
This is a recent Ohio Senate Health and Human Services Committee hearing about diabetes awareness. An Ohio woman's sister-in-law tried to stretch her insulin supply
and passed away due to cardiac arrest, which was brought on from rationing her insulin.
We can't allow this to continue.
Senator Nikki Antonio from Lakewood says she will introduce a bill later this year that caps patients' insulin costs at $100 a month.
I want to make an adjustment.
What it will mean is the difference between life and death for some people.
The Diatribe Foundation reports 8 states so far limit insulin costs. 5 more states are considering it as we speak.
I don't want any other family to go through any of the things that we have gone through.
We may have a fight on our hands, but I am determined to be able to put in the hands of people who need it an affordable medication for them.
So I also have a glucose sensor.
David knows that feeling. At one point, he had to switch insurance plans and was shocked by the $750 price tag for just 3 vials of insulin.
You feel really kind of, what the heck? Here we are in the United States of America, and I'm not sure how I'm going to afford this.
I'm 5 on Your Side investigator Jonathan Walsh.
Heartbreaking are those family testimonies. Now, David is now on a pump system for his insulin, but says the retail price for his supplies is more than $5,000 for 2 to 3 months of treatment.